Hi, I'm Dr. Ernie Bowling, Chief Optometric Editor of Optometry Times, and I want to talk for just a moment about an editorial I recently penned about the book Doctor. Basically, what can Doctor teach us about optometry? I recently finished the book titled Doctor, The Disillusionment of an American Physician by Sanjeev Johar, MD. The author is a New York cardiologist, and his memoir is still on the New York Times bestseller list since it's released in August of 2014. In general, the book is a very scathing criticism of our healthcare system, told in a very open and quite honest manner, I felt. I did find myself reading early on. I started substituting the word optometry wherever there was medicine, and found there were a lot of messages in this book that ODs could glean. For example, 80% of medical diagnosis can probably be made on the basis of the patient's case history. So, my old optometry school professor was right. The case history never ends. Thanks, Jim Marburg. He also subscribes to the Yogi Berra School of Physical Diagnosis. You can learn a lot by looking. While the author takes a very dim view of private medical practice, those guys are a bunch of crooks, he says, and did I really want to become another private practice grunt, kissing asses, over-testing, fighting insurers to get paid? He learns a tremendous about this from his successful surgeon brother. That practice success is basically derived from the 3 A's: availability, accessibility, and affability. His brother claimed he learned that lesson from private practitioners. Dr. Char also quickly caught on that no matter what your practice environment, it was important to see as many patients as possible. The culture today is grab patients and generate volume, the author laments. He chafes at seniors doctors' abuse of junior associates. He abhors the practice of taking on young associates and then, quote, exploiting them for cheap labor, then firing them when they were up for partnership. He recalls a private cardiologist bragging about hiring fresh graduates, running them into the ground for 2 years, then letting them go and enforcing a no-compete clause in their contracts if they tried to set up an office nearby. Terribly sad. Dr. Johar is even critical of medical education. Quote, medical education teaches the bad lesson that in order to succeed, you have to memorize. They are never taught to think. I have worked in teaching hospitals, he said, and I have discerned a gradual decline in the intellectual climate of these institutions. It has been dispiriting to watch, he says. Of all the places one might expect doctors to be curious about medicine, teaching hospitals should be first. I love to teach, a doctor told him, but the residents and fellows just didn't want to learn. They had, quote, other things on their mind. Dr. Johar saves his harshest criticisms, however, for the, quote, perverse financial incentives of our current fee-for-service system, especially unnecessary medical testing. No one ever goes into medicine to do unnecessary testing, he says. However, this sort of behavior is rampant. Everyone's looking for procedures, a colleague told him. According to another one of his associates, if a doctor doesn't do excess testing, forget it. He isn't going to be able to earn a living. The author, with all his worries and all his misgivings surrounding the medical profession, is still optimistic. Every patient teaches a lesson, he says, and boy is that true. And what, despite all the shortcomings, redeems the effort put forth? It's all in the tender moments helping people in need, he says. Focus on your craft and your relationship with patients, since this is something that we all can control. That is a take-home lesson for optometry as well. It is the overarching reason we do what we do, to care for our patients. And he asks toward the end of the book, what kind of a doctor do you want to be? It's a great question for us all, no matter what our healthcare discipline. I'm Dr. Ernie Bowling. Thank you.